Hi everyone, welcome back to the channel. And yeah, I know I'm shooting these videos after quite a long while. I was like actually not quite well in past 2 weeks, so throat and all that was going on. But keeping all aside, let's begin. So I'm going to talk about neck. Again, before beginning any video, a disclaimer. Disclaimer is that these videos are best of to my knowledge and as per the latest information that we have available today. Since the medical education is always evolving and always evolving, so these things might change later on in future. Though anatomy does not change much, but still, there is always a chance. So yeah, that's the disclaimer. So about the neck, as you all know, that neck has two triangles. We'll just talk about the posterior triangle in this video. But prior to that, what is neck? Neck is basically a region that is between head and thorax. Now we need to know about its boundaries. For that, you can imagine the fact that I'll just add a pic for you. So here we have the pic of the neck. So here it is. So basically the neck is a region that is bounded anteriorly in midline, imaginary midline you can say, and posteriorly by the anterior border of the trapezius, inferiorly by the clavicle, and superiorly, this is the midline, superiorly by the lower margin of the mandible, and then from the angle up till the mastoid process, and this is the roof. Ignore the notifications. So now we'll just draw a very beautiful diagram about the neck, and in that it will be very clear to you that how you can easily understand neck. It's very simple diagram. So you can imagine the fact that this is your mastoid process, this is styloid process. In front of it you have your ear, then you have your mandible, and then from here you have your hyoid bone. Over here you have your sternum, behind sternum you have your clavicle, and this is the posterior neck. That is the posterior of the head of the nuchal line, you can say. Let me extend the clavicle a bit. So I'm sorry. So this is how an outline of the neck will look like. This is mandible, this is hyoid, this is sternum, this is clavicle, this is mastoid, this is styloid, obviously the mastoid process. So the posterior boundary was the trapezius, that is the anterior border of trapezius. So this is your trapezius, whereas all of you know that the neck has divided into two triangles, basically the anterior and the posterior triangle, then they're further divided. So this division is mainly done by a muscle known as the sternocleidomastoid. So that is somewhat like this. It has its two heads, sternal head and the clavicular head. This is your sternocleidomastoid, going at the mastoid process and posteriorly at the nuchal line by the crisscross of the fibers. I'm not going to go into detail about that. So now you have two triangles. This one, wait, hold on. This one and this one. So this is your anterior triangle and this is your posterior triangle. Now I'm going to draw certain structures in it. I mean to say certain muscles in it. So firstly I'm going to draw a digastric muscle. Pardon me, this is not hyoid, this is thyroid cartilage, and this is hyoid. Sorry for my drawings. This is hyoid, and now I'm going to draw a digastric. Digastric has two bellies, the anterior belly and the posterior belly. So this is one triangle, this is another triangle, this is submental triangle, this is submandibular triangle, and now you have a muscle known as an omohyoid. Omohyoid muscle has superior belly, inferior belly. About all these muscles I'll cover with the anterior triangle of the neck. Right now I'm just going to focus on the posterior triangles. Okay, so this is your carotid triangle, this is your muscular triangle. Now the posterior triangle, we have two triangles. This is your larger occipital triangle, and they are divided with the help of the inferior belly of the omohyoid. This is inferior belly of omohyoid. It divides the posterior triangle into occipital triangle, and this whole one is your subclavian triangle, or it can also state it as just this one. So it depends from book to book. Okay, so now we are just going to focus about the posterior triangle and the sternocleidomastoid muscle. But before that, I'm just going to talk about the two spaces that are formed. Like this space you can see, and certainly this space has a specific name. This space is known as your lesser supraclavicular fossa. This is in between two heads of SCM, and it contains internal jugular vein. Same way we have something known as greater supraclavicular fossa, and this is between the middle third of the clavicle. Like this is a clavicle, so this one, the middle 1/3 of clavicle it is. It contains subclavian, it contains third part of the subclavian artery. We use red because it's an artery. Third part of subclavian artery, that is VITCD. The D, this is from the first part, this is from the second part, and this is from the third part, that is the dorsal scapular artery. So that's how it's going to be. And in the neck you have these two muscles, SCM and the trapezius, as your superficial muscles. And now I'm going to talk about the sternocleidomastoid muscle first. The sternocleidomastoid muscle, it has two heads, two origins from the clavicle adjacent to sternum, that is known as the clavicular head, and from the anterior surface of the manubrium of sternum. Sternum, basically the manubrium anteriorly. Okay, and its nerve supply is spinal CN11, that is the spinal root of the accessory cranial nerve. Now its blood supply, the arterial supply. So now look, sternocleidomastoid, it's having its insertion. I forgot to mention about the insertion at the mastoid, the lateral aspect of the mastoid and the superior nuchal line. So the clavicular head will go and insert at the superior nuchal line. Sternal head will go and insert at the mastoid. So the arterial supply is going to be Just imagine that where it is inserting in the sternocleidomastoid. So imagine from there, arterial supply is going to be the occipital artery, posterior auricular artery, superior thyroid artery, and suprascapular artery. These will supply it in the upper 1/3, this will supply it in the middle 1/3, this will supply it in the lower 1/3. Okay. Now SCM is pierced by, it is pierced by cranial nerve 11, the spinal part of it, and the 4 arteries which are supplying it, these 4 arteries. Okay. Now I'm just going to talk about the superficial relations because deep relations बहुत ज़्यादा है, don't need इतना ज़्यादा याद रखना. Superficial relations. Superficial relations beginning from outside skin, that is a muscle that is in the facial sheath, certain cutaneous nerves. Just remember the names of these 4 nerves. इस पूरे लेक्चर में I'm going to mention them again and again. Great auricular, lesser occipital, transverse cervical, and then your medial supraclavicular. Just remember supraclavicular, to be it's enough. Then 4th one, external jugular vein, certain lymph nodes, that is supraclavicular lymph nodes in some cases, and then a parotid gland in its upper part. Okay. So that is about the sternocleidomastoid muscle. Now I'll talk about, I'm not going to about a clinical aspect in it, clinical aspect alag se video I'll make for it. Now I'm going to talk about this part, the posterior triangle proper. Okay. So now I'll talk about its boundaries. So just see, posteriorly you have the anterior border of trapezius, anteriorly you have the posterior border of the sternocleidomastoid, inferiorly you have clavicle, superiorly an imaginary line joining trapezius with SCM, or the superior nuchal line in that area. Okay. So let's write down the boundaries जो मैंने अभी डायग्राम में एक्सप्लेन करी थी. Anteriorly, posterior border of sternocleidomastoid, posteriorly anterior border of trap, inferiorly clavicle, but which part of the clavicle? The middle 1/3. Superiorly basically junction of SCM with trap as per the books. So now we need to know about 2 more things, roof and floor. Floor is easy, so पहले floor को पकड़ते हैं. Floor contains certain muscles. Now these muscles are going to be, different books are different, so I'm just going to just club them up. So first one is your splenium capitis, semispinalis capitis, levator scapulae, scalene, anterior, middle, posterior, some part of serratus anterior. Okay, partly, let me mention partly. Then this fascia, Basically, it is embedded in the basically there is a presence of a deep cervical fascia. It has certain layers like investing layer, pre-vertebral layer, pretracheal layer. So it's like that. So let's go and check. I'm not going to go in detail about those layers, but yeah. So now I have explained you about the fact that there is that fascia. So about that fascia. So the deep cervical fascia has 3 layers basically. This is just something extra that you need to not understand. Investing layer, pre-vertebral, and pretracheal. Okay, so over here this fascia is the pre-vertebral layer of deep cervical fascia, and under it basically lies all the axillary structure. So this forms an axillary sheath that extends up till your arm. So if there is some abscess under this fascia, the pain and symptoms can occur even in arm. Okay, so now I'll talk about the roof, that is its superior covering. Roof, so roof is formed by the investing layer of pre-vertebral fascia. Okay, and the roof contains platysma, external jugular vein, posterior jugular vein. So you must have noticed कि muscles and arteries are, I use a red color, for veins I use a blue color. Now structures piercing the roof. Remember about those nerves, these nerves that were piercing the sternocleidomastoid, were in superficial sternocleidomastoid. Those are going to pierce the roof over here. That's how they're going to be superficial to the superficial sternocleidomastoid. Okay, so again, for cutaneous nerves, namely greater auricular, that has a root value of C2 C3, lesser occipital, that has a root value of C1, transverse cervical, that has a root value C2 C3 again, and one is left, that is supraclavicular. It has a root value C3 C4. So C1 C2 C3 C3 C4. Okay, C1 C2 C3 C4, like that. So one from here, that is lesser occipital, two from here, that is transverse cervical and greater auricular, and one from here, this one is going to be your supraclavicular. Okay, so like that also you can remember. And another structure that's piercing is external jugular vein. I'm really feeling tired and sleepy in just like while making a video 15-20 minutes only. So right now also my health is not good. Now I have already told in the diagram that the posterior triangle is divided into two: occipital triangle, subclavian triangle, by the inferior belly of the omohyoid, this part. Okay, so now we need to know the contents of both the triangles, both the basically posterior triangle and 2 by 92 occipital triangle and subclavian triangle. Okay, now there are certain nerves that are present. So these nerves are again those 4 nerves: lesser occipital nerve, That's why I said remember these: greater auricular, transverse, cervical, supraclavicular. Now remember the root values. It's easy. And then they are going to be, these were the cutaneous nerves. Now certain muscular nerves. Okay, you know that trapezius is over there, so a branch to the trapezius. I'm talking about the nerves from the cervical plexus. Okay, not the cranial nerve that is supplying it. A branch to levator scapulae and a branch to rhomboids. Better to say 2 branches for these two and 1 for this. Okay, now coming on to the nerves from the subclavian triangle. As the name says, subclavian nerve, suprascapular. Okay, over here you have supraclavicular, over you have suprascapular. Then remember that mnemonic, ready to drink chilled beer. Out of that, RT is here, that is roots and trunks of brachial plexus. And then last one is the long thoracic nerve of Bell. That supplies us serratus anterior. So these were the nerves. Now certain blood vessels. It's easy, very easy. Occipital triangle, occipital artery, and transverse cervical artery, transverse cervical vein. On this side it was a subclavian triangle, so subclavian artery, but third part, because third part is the one that is bent in this triangle. Okay, subclavian artery. Now suprascapular artery, suprascapular vein, the origin and end of transverse cervical artery and transverse cervical vein. It originates from here and goes here, and it comes from here and drains here, like that. Okay, then you have your external jugular vein. Then you have certain lymph nodes. Occipital triangle will have occipital lymph nodes, and this will have your supraclavicular lymph nodes. On left side they are also known as the Virchow's nodes. So for your entrance exams you just need this much. Basically this comparison table is enough, and the boundaries of the posterior triangle are enough for entrance exams, but I'm just going in a little bit of the detail in case someone wants to know a bit more. ज़्यादा कुछ नहीं है, I'm just going to talk about some main these 4 nerves, basically nothing much. So before that you need to know that cranial nerve 11, that its spinal branch, spinal root, it supplies the SCM and the traps, so it can get injured in any kind of biopsy or surgery that is done in posterior triangle. Okay. Then I'm going to talk about lesser occipital nerve. It is present superficial to the sternocleidomastoid, all of you know that, and this is your, for example, the ear, the medial aspect of the ear. So lesser occipital supplies the upper 1/3 of medial aspect of external ear. For details, I have the video about ear on my main channel. Actually, at that time I was just having one YouTube channel. So about ear, main video is on this channel. I'll also put a link in the description box though. That is by my name only. I don't know what's happening with my device today, but it's okay. The second one is greater auricular. Okay, so the greater auricular, it comes at an angle of mandible. Nerve roots I have already mentioned before, C2, C3. Lesser occipital is C1. So at an angle of mandible it comes and it divides over here into two, anterior and posterior. Okay, now obviously it is dividing, so it will also supply the lateral as well as the medial aspect of the ear. So it supplies lower 2/3 on both the surfaces, that is on lateral surface and medial surface. Then next one, transverse cervical. You just don't need to know much about it, just know that it is present deep to the external jugular vein. And it has two branches. It basically gives off and divides into two, ascending and descending branch. Where it goes and all, I'll cover them in a separate video. Next one, Supra clavicular nerve. It is basically one trunk that divides into three. Medial, intermediate and lateral. So these all are present with respect to the medial 1/3 of clavicle, middle 1/3 and lateral 1/3. Okay, so it's easy. Their names are according to the parts where they are present, and then they supply the chest wall, basically the skin of chest. Sorry, not the chest wall, skin of chest, better to say. All of them. Just the catch is these two are always present in front of clavicle, whereas intermediate one, sometimes it is present in front of clavicle and sometimes passes through and through. So like that. Now you need to know certain nerves with respect to their relation to the sternocleidomastoid. So let's divide it into upper 1/3, middle 1/3 and lower 1/3. Okay, so over here at this junction you have all the four cutaneous, those famous cutaneous nerves: lesser occipital, greater auricular, transverse cervical, and the last one being your supraclavicular plus cranial nerve 11th, the spinal part of it. Okay, then so since this is also hence a site of cervical nerve block. Okay, then with respect to the middle one third, you have the nerve to the cutaneous nerve to levator scapulae and trapezius. Okay, so well, that's all for the posterior triangle. Thank you. So the clinicals, it will be covered separately. You can reach out to me on my Insta. Go to my Insta. My main account is by this name as Prabhjot, whereas there's another one, anatomy by Prabhjot. Okay, thank you, bye bye.